The first thing I'd like to do is discuss some of the larger themes that we see in both papers, and then I'll raise some questions. And even though the authors themselves have been very, very careful in their conclusions to make sure that their conclusions are backed by data, I'm going to make some of my questions and even comments will be a little more speculative to think about what might be behind these numbers. Some of my comments may seem a little bit obvious to the authors of the papers, but I've geared them for the scope of our audience today, so that we'll just keep that in mind. Okay, so let's talk about the themes, and I've identified a number of themes here that I think we see. The first that I want to talk about, and perhaps the most important, is that we see some of the intended and even more interesting unintended consequences here of PRC policies and programs of social control and social engineering. The most important of these, of course, is the household registration system, at least the most important, I think, in these two papers. It's an artifact of the Maoist period, which continues today and has created in China, at the very least, dual-class citizenship. There are those people who are born with urban household residency, hukou, the word that was just used in the most recent paper, and those who are born with rural household registration. I say at the very least dual-class citizenship because within each of those categories there's a variety of gradations. So that if you're born in a large East Coast city, you have sort of more privileges and more opportunities than you would be in, say, a small interior town, even though you both have urban household registration, and similar things apply with rural household registration. Household registration shows up in health insurance programs available to Chinese people, as well as in their patterns of marriage, and just a few examples drawn from the papers. Rural residents are less likely to have outpatient coverage than urban residents. Rural to urban migrants are the least likely group to have insurance. And in regard to marriage, 90% of husbands and wives come from the same county. Marriage is a profoundly local business. The second social engineering policy, which we see in these two papers, is family planning, as implemented in the one-child policy and its successors, sort of what I think of as the one-and-a-half-child policy of today. And this is the heart of the skewed sex ratios in the first paper, in Professor Zhang's paper, which have resulted in larger numbers of men than women. We all kind of assume because of abortions of girl fetuses that are identified through ultrasounds, even though taking an ultrasound to determine the sex of a child is illegal in China, as I understand it. Okay. So social engineering is, the first big theme that I see in both papers. The second one I want to talk about is gender. Men and women have unequal access to health care and radically different places in the marriage and thus, according to the authors, the housing markets. When I was teaching, just as an example, in China last year, I taught a class of USC students at Fudan University in Shanghai. And I had several Fudan students, undergraduates, sit in on the class. And we were talking about housing prices in Chinese cities. And I asked the students, who happened to be, in this day, two young women, two young, highly educated, professionally purposed women at an elite university in China, what they felt about housing prices, and they were completely unconcerned. They said, it doesn't affect us because the boys that we will marry will buy the houses. Where's my TA? She can attest to you, yeah, she can attest to you that I went ballistic and called them both feudal, which is PRC speak for backward, unenlightened, and whatever else you want to apply to it. They were completely unfazed because they don't have to buy houses, I guess. So we've got social engineering, gender, and number three, local variation. This is the third theme that we see in both papers here. Local variation, where people are likely to have more health care in rural Gansu than rural Zhejiang, of all places, but also local variation where we see people in Zhejiang having inpatient care and not in Gansu. Insurance premiums, levels of coverage, types of coverage all vary widely. And the same is true of housing prices and the unevenness of sex ratios. I was quite interested in the chart that Professor Zhang showed us just now that sort of showed that there are places in China where the sex ratios are close to 100, and I would love to know a little bit more about that. In addition to these three themes, there are other themes that I see in both papers that I don't have time to go into here. Opportunities based on age, the functions of families and the roles of work units in dispensing welfare, including housing and housing subsidies come to mind. Okay, here are my questions, and some of these were addressed in the presentations today, so in no particular order. To begin with the paper on healthcare, which I read first, just by coincidence. At least among my circle of friends in China, health insurance fraud is so common that I really wonder what impact it might have on the way people are reporting their coverage. I've known people who've had entire operations using other people's health insurance cards. And if you've been to hospitals in China, you have a medical book or a medical card that you take with you. You keep your own medical records most of the time. And so if you've got someone who has health insurance card that has been used by 2 or 3 different people, they have quite an interesting health medical record. And this is not incredibly relevant to Professor Strauss's conclusions, but just an item of curiosity I have, and that is that party members, I was wondering if you knew if party members have differential access to health care. Party members who are not actually employed in the government. I assume that government employees have employer health care plans. We see in healthcare some effects that I think are coming out of the old social engineering systems of the past. The fact that men are more likely to get health insurance from the employer systems that women indicates to me, and here I begin speculating, the effects of the fact that the layoffs from the state-owned enterprises were disproportionately women. And that employment very often in China is embedded in ideas of the family. We'll lay off the women and the men can stay on. If you want a job, they ask questions, are you married, do you have children, do you have parents that you support? That many of these decisions are made based on family status. And I think we see this also in the fact that educated women, perhaps less likely to be laid off, are more likely to have health care as well. Professor Strauss answered at the end of his presentation the question I had here, which is this real health care? And he concluded, no, it's a subsidy rather than health insurance. But I asked the question because health care doesn't seem to affect usage. The fact that people get subsidized for part of their health care doesn't affect their decision to seek health care or not. And I don't know if this is because of the low rates of reimbursement or because of lack of access to health care. In my discussion with rural people, mostly rural migrants to cities, when I ask them about their lives back home or the lives of their families back home, one of the first things they think to tell me is about the lack of health care available to their parents. And I say, you're working here in the city, can't you send money back? And very often the question is, no, it's not the price of health care. There just isn't any. They're too far away, it's too hard to get to, that there's a lack of access problem, and I wonder how that affects utilization. If it isn't the lack of access, if it is just the low levels of subsidy, then, and this is speculation or a speculative question, what is the tipping point? How much money does the government have to invest to have the healthcare system actually make a difference in people's willingness to seek medical treatment? Okay. Moving on to the Professor Zhang's paper on marriage and housing. I find your conclusions persuasive, but I do wonder a little bit, especially in urban areas, whether marriage leads to whether home ownership leads to marriage or marriage leads to home ownership. The rural areas, I think your anecdotal evidence as well as your statistical evidence is quite persuasive. But in places where housing is financed primarily through mortgages, the sort of dual incomes of a married couple might actually make a difference there, and I'd be interested to know about that. That would not necessarily vary with sex ratios, so I'm still convinced by your argument, but I'm interested to know more about that. I know just anecdotally from my friends in China in urban areas that there are 3 requirements that every woman looks for in a man, and that is, you know, 有房有车有保姆, which is they want a house, a car, and a maid. And for those of you who haven't spent a lot of time in urban China, if you're in a major city in China, what I tell my students is that you either have a maid or you are one. The second question you addressed a little bit in your presentation, but just something to think about, and that is whether or not people buy houses where their household registrations exist. And you indicated, at least among the rural people that you talk to, that they tend to go back to, you know, not where they live, but to the location of their household registration to build their house and also to get married. And I think that's interesting, and I wonder if that's changing or how that might affect things. Once again, this is beyond the level of the data that you've presented, but I'm just kind of 借题发挥. Okay. We see here, you know, also the effect of the one-child era that allows the concentration of family resources in particular ways. And so, you know, one of the underlying assumptions here is that families are able to concentrate resources on the purchase of homes because they are positional goods. This is something you didn't go into very much in your presentation, but it's very important in the paper, and that is that some goods are more likely to attract wives than others. Right? Some goods represent your status or your position in society in ways that other goods do not. So if families with sons are focusing all of their investment on positional goods, that leads to a number of questions. One of which is what are they not spending money on? You know, sort of what's being sacrificed in these family budgets. And what about the families who have daughters? You know, has the one-child policy, at least in, say, urban areas where they're likely to have only one child, has the one-child policy created a group of son having saver accumulator positional good buyers and a group of daughter having consumers? It's just a thought that has occurred to me. A couple of small questions as well. In your paper as well as in Professor Deng's paper, we've talked about renting versus buying. And I just am a little concerned about what renting actually means in China. For large numbers of people who got their houses through the old housing allocation system, but did not purchase their houses during the market liberalization of the 1990s, they are still renting, technically. And these are usually lower income urban residents, as far as I know. And the ones that I talk to have stopped paying rent 2 or 3 years ago, if not longer. So they're renting their houses, they never purchase them, but they proceed on an assumption that this house is theirs and that it will be theirs to pass to their children. They have a kind of ownership right there, even though they don't actually own it. And that ownership right may not extend to selling the house, but I think it certainly extends to occupation. And my experience tells me that they would be likely to be evicted, you know, at death, that their children would indeed be allowed to live there. So when we look at renting statistics and rental rates, I'm not sure that they're entirely representative of market trends. So that's just a thought. Well, I don't know if I'm talking fast or if I just have little to say, but I seem to be within time today. Okay. So, just to sum up a little bit here, the two papers that we see today show many of the contradictions of the PRC state and many of the contradictions that we've talked about in the last 2 days. For example, we see the contradiction between an ossified and outdated social engineering policies and the high mobility of Chinese society. So you have people with rural registrations who are living in cities, people who are having more than 1 or 2 or whatever the allotted number of children are because of their ability to avoid sanctions or to cope with sanctions. And this crisis between the desire to have social engineering and to allow for mobility, or this contradiction or this tension exists in many areas that we've discussed this weekend. And an example that comes to mind is a couple of essays I've read lately. And I'm sorry to keep raising Shanghai, but it is my home away from home. The Shanghai government is very concerned about the aging of its population because it's aging more rapidly than the Chinese population as a whole. One of the proposals to fix this is to allow people with Shanghai residency to have more than one child. When the obvious, clear, and elegant solution would be to grant Shanghai residency to somebody, to some of the millions of migrants who actually live in the city, you know, that would solve the problem tomorrow. But rather they are thinking of continuing or trying to go back to or staying with these kinds of social engineering policies, which imply racialization is the wrong word, but these sort of basic fundamental distinctions between Shanghai people and non-Shanghai people, between rural people and urban people, between Beijing people and Gansu people, that these are being, that these distinctions exist in law and are being reinvented every day. A second tension that I see in these two papers is the tension between the official kleptocracy, where we know that many officials are sort of out to line their own pockets and have done so, and the willingness to work for people's welfare, because we see both of these things in these papers. We see a contradiction between those whose paths are determined by birth, either because they're birth in a particular gender, birth in a particular household registration or in family status, and a meritocracy where the best and the brightest, such as Hu Shuli, who gave us such a wonderful talk yesterday, can thrive. And finally, and this is getting way beyond the papers that we've seen today, but the contradictions in this conference that we see between those who see things as getting better and those who focus on China's very real and daunting problems. And the only thing that I can sort of say there is, this is why studying China is so fun. It is a place where things do seem to be getting better, where there are policy initiatives to improve people's lives, and at the same time where there are huge and unimaginably difficult and complicated problems. So I will stop there.